So if you're missing multiple teeth, your options really are limited to either going the route of doing conventional dentures, which are held in either by suction from the roof of the mouth or, realistically speaking, adhesive. The two other options, which are honestly the vastly superior options, is going the route of either having implants placed so that a denture can snap onto them and be held in place, and that way you don't have to use adhesives, you don't have to rely on suction from the roof of the mouth, and just provide you a restoration that's much more secure and comfortable for you. And the last option, which in my opinion is the best, is the fixed option, where a bridge is made that screws down directly onto the implants, is completely fixated in place, doesn't move, and doesn't come out unless we remove it for you. Taking it out and screwing it, they usually never come out, and they last a very long time. And the other advantage of having implants in place to help support either a denture or a bridge is that while those implants are in place, you're maintaining the bone in the areas that they're located in, so that you're not having resorption, which can cause changes in your facial structure and make you look older. The biggest thing to consider is whether or not the bone is available to place implants. If you've been missing teeth for a very long time, you tend to have resorption that happens over time as a result of that, especially if you've been wearing dentures and they've been putting pressure on your gums throughout that time. And the way we figure that out is to get you in. We take a 3D x-ray so that we can evaluate your bone in detail and determine whether or not you are a candidate for being able to immediately start to place implants, or if potentially bone grafting needs to be performed first and then implants placed. The biggest advantage of having dental implants done in Martin Dentistry is you're with a doctor who does everything for you beginning to end, which is honestly novel in dentistry. Being able to have it all done under one roof with the same doctor, the same face, really is, it makes a big difference for a lot of patients. The implant solutions that we offer transform some people's lives. I mean, patients that have been living with dentures for decades, or patients that have had a lot of decay throughout their mouth, or have been dealing with pain for years and years, dealing with teeth breaking and not being able to eat, not being able to speak normally. And then coming in, having the implants placed, and having a bridge set on them that's fixated, that looks great, and that allows the patient to finally speak and eat again normally. To see the effect that it has on patients and really how much it improves their lives, it's great. If you're interested in implants, or even just curious about whether or not you could be an implant candidate and not really sure if you want to dive in yet or not, just see what the potential is, all you have to do is give us a call and schedule a consultation, free consultation. We're more than happy to get a 3D x-ray, look at your bone, review your medical history, and figure out for you what's possible.